Hi, everyone. My name is Sidney, and today my presentation is about breast cancer, an overview with a focus on triple negative breast cancer, or TNBC, and menopausal status. So I'll be explaining a little bit more with the few slides. And my mentor was Dr. Andrea, who I think is here today. And yes, so first, the biology of the breast. As you can see in the left image, this was actually created by my mentor. The main function of the breast is it is used for the secretion and production of milk in women, and also men also have breasts, but this is mostly used for women. And then as you can see here, in the left image, lobes are the main area for the production of milk where it will travel through, and milk will eventually exit the nipples outside of a woman's breast. After that, in the right image, you can see where the lymph nodes are in our body, focused mainly on the breast. And this is where the cells fight off dangerous bacteria and cells, which could be potentially dangerous to humans or the patient in general. So first, statistics of breast cancer in the world. In the left image, you can see this is the statistics in 2018, focus on women before the age of 50. And as you can see, mostly in the African region are where the statistics are higher, mainly due to like low income and other factors. And in the right image, you can see this is the statistics for women after the age of 50 or post-menopause. And you can see that the statistics here are higher among women in the European region. So breast cancer. There are different ways to classify breast cancer, such as tumor location, invasive capacity, and other factors. Ductal carcinoma in situ, or DCIS in short, is the most common type of breast cancer among women around the world. And the World Health Organization actually classified 17 special types of breast cancers, which can not really that common among women. However, the most aggressive type is called triple negative breast cancer, or TNBC. So for like a really brief explanation, since it's kind of complicated, but TNBC basically is a woman has no estrogen or progesterone receptors, which are like the most common hormones for women, and they lack HER2 expression, which is a protein, hence why it's called triple negative breast cancer. So for the treatments for TNBC, or triple negative breast cancer, we have the standard treatments, which are usually associated with breast cancer or cancer in general. So we have mastectomy, or breast conserving surgery, which is when they remove the breast of a woman. And then next is radiation therapy and chemotherapy, which are therapies usually common for breast or cancer in general. However, I feel like if you know someone who has cancer or who has gone under these treatments, they can have really adverse side effects, and it could actually really be sometimes deteriorating and tiring for someone's body. And also I feel like mentally it can be quite challenging. So I also researched on some target treatment options, which uses a patient's immune cells to be able to properly treat the cancer cells and eventually fight them off. So with the complicated names, we have the PARP inhibitors, or PARP, CTLA-4, and PD1/PDL1. These are the treatments, this is just actually a few examples of target treatment options that have been proven to effectively treat TNBC, but I would suggest that there would be more research to be conducted, since it's kind of a new topic, but it has some promising results. Now, menopause and breast cancer. So first, what's menopause? And if you're a girl or a woman who's probably overage, you probably know what it is. But it is the time in a woman's life where her ovaries stop functioning and periods no longer occur. So on average, with most women around the world, menopause usually occurs on average at least by the age of 50. And postmenopausal women are more likely to acquire breast cancer. And there could be a number of factors regarding this, such as hormonal therapy, since women who are usually postmenopause feel more insecure about not functioning as the same as they used to during their youth. And people opt to get hormonal therapy just to replace the hormones and feel better about themselves, which is kind of disadvantageous for them, because this could increase the risk of breast cancer and overweight, since menopause postmenopause and overweight status could sometimes lead to having an increased risk of breast cancer and estrogen exposure. Since if you've been living longer, you've been exposed to estrogen for a longer period of time, which could increase your risk of breast cancer. So, knowing all of this, my research focused on the risk of TNBC in association with menopausal status. So what I did, or my methods, I conducted a systematic literature search on different studies about menopausal status and TNBC risk. So I did also a literature review, and I just tried to research on different studies about breast cancer, TNBC, and menopausal status to see if there was a correlation. Then I reviewed the different studies to analyze the results and their findings. So I just based on what their results were, that's how I kind of based on my research as well, and extracted and compared the data of the given studies. So I created a chart to be able to compare and see what were the results and if there was an association between those two factors. So these were my results. As you can see, I only have 2 studies that had a p-value of more than 0.05, and everything else was less than 0.05, which showed that there was a positive association between menopausal status and the risk of TNBC. So the things to ponder on, or my conclusions of what I learned from this research study, was that there was a lack of breast cancer awareness, especially among women. Through researching, there was not a lot of education, or there was a lack of knowledge, especially among women, about breast cancer, since I feel like some of them were uncomfortable or afraid about this topic, since it's not something usually talked about in the public. But it was kind of disappointing, or it was kind of sad to see that not a lot of women knew how to treat themselves or diagnose themselves, or knew about this issue. Next was lack of resources and finances for treatment. This goes especially for women in low-income countries, or some women who are from religious different backgrounds, since they don't really believe in these kinds of treatments, that they don't have the resources, or they just don't have the money to be able to afford, since treatments are really expensive and not many people have the privilege. So it just begs you to question, if you are from a low income country, but you do know you have breast cancer, what are you supposed to do? And next is more research for targeted therapies on TNBC. Like I mentioned before, the standard treatments, it's kind of it does have adverse side effects, and it can really damage your body just so you could possibly not get cancer again, or possibly be treated. And I feel targeted therapies are just a way, or an option for many patients that not people have a lot of research on, but I would really want to see more research done on that field. And the impact of menopausal status on TNBC and breast cancer in general. So conducting my research, I noticed that in TNBC, it is more common among premenopausal women. And it's kind of interesting to think that, since breast cancer is usually common among postmenopausal women. So I feel more research has to be done on that, just to see what's the difference, why is it like that, and yeah. And then for my overall experience, I would really love to thank my mentor, Dr. Andrea, because she was so inspirational and so caring with my lots of questions. I had no idea what to do, and she was really open to be able to help me with all these things. And it was nerve-wracking at the beginning, I'm not gonna lie, since I felt really overwhelmed with all of this experience, and I feel the others could relate as well. But as you start to get into it and start to get into groove, you really just feel more enlightened, and it was really a great experience. And it was such a memorable and unforgettable experience, since I was able to learn so many new things in the span of a month that I probably couldn't have learned if I was just at school doing homework. And although it was really nerve-wracking and so oh my gosh, what am I supposed to do, I was really happy that I would join this experience, because it was such a great and something we would never forget. So I would like to say thank you for listening. Sorry for the technical difficulties, and thank you for this experience.